Welcome to Mending a Broken Heart Failure and Artificial Intelligence Risk Assessment with Revolutionary Technology. I'm Risha.
I'm Aurel.
I'm Shanze.
I'm Ronak.
Heart failure was here long before COVID was, and it is even more deadly. 300,000 death certificates every year in the US have heart failure written on them. Heart failure is a chronic clinical syndrome where your heart cannot adequately pump blood, and it is mainly caused by heart diseases, some being aortic stenosis, cardiomyopathy, myocarditis, and also myocardial infarction, also known as a heart attack. And there are 4 definitions of heart failure: left-sided, right-sided, diastolic, and systolic. Left-sided HF is when the left side of your heart cannot efficiently pump blood from your lungs to the heart, and this further causes right-sided HF, where the right side of your heart loses its contractibility. Diastolic HF is when your ventricle walls are abnormally thick, causing your blood volume to decrease. Systolic HF, on the other hand, is when your ventricle walls are abnormally thin. Now, one major factor of heart failure is your ejection fraction, the ratio of blood being pumped out of your ventricle to the total amount of blood in your ventricle. A normal EF is 50 to 70%. And there are 2 significant EF abnormalities regarding heart failure: reduced and preserved. Preserved EF is when your EF looks normal, but you are still in heart failure, and this can be seen in diastolic heart failure. Now, systolic HF is an example of reduced EF, where your ejection fraction is less than 40%. Now, unfortunately, the signs and symptoms of heart failure are easily overlooked, the primary symptoms being nausea, chest pain, fatigue, and shortness of breath. Another symptom is systematic vein congestion, in which blood clogs the veins, and this further causes dyspnea, trouble breathing, orthopnea, trouble breathing while lying down, and also pulmonary and peripheral edema. Now, why is heart failure so important to our community? The prevalency of heart failure has rapidly increased globally, making heart failure a global pandemic. By the age of 40, you have a 1 in 5 chance of experiencing heart failure, and diagnosed patients don't live past 10 years. 800,000 new cases of HF are diagnosed every year in the US, and currently there are 5.7 million cases. And by 2030, that number is projected to be over 8 million. Heart failure is not only in my community, but it's also in yours, which is why it's so important we take this heart failure pandemic seriously. Now I'll hand it off to my colleague Arul, who will talk about the risk of sudden cardiac arrest with heart failure.
Thank you, Risha. Heart failure comes with a burden. Aside from not adequately pumping blood to the rest of the body, many heart failure patients have other conditions, just like ventricular tachycardia and ventricular fibrillation. Ventricular tachycardia is when the ventricles are contracting so fast that the heart is unable to fill with blood. Ventricular fibrillation is when the heart's electrical signals don't align at a coordinating time, causing the ventricle walls to quiver and not effectively pushing the blood out. Both of these conditions lead to arrhythmias, the leading cause of sudden cardiac arrest. Meaning, because heart failure patients have conditions just like VT and VF, they're 6 to 9 times more likely to have a sudden cardiac death. What can we do to prevent it? We need to address the risk factors, which include hypertension, diabetes, congenital heart disease, viruses, alcohol use, tobacco use, obesity, and most importantly, sleep apnea. Sleep apnea is the most common risk factor for heart failure that often goes undiagnosed and untreated. Well, why is this important? During the night when you're not sleeping, your airways are restricted, meaning you're not intaking oxygen, and that triggers your sympathetic nervous system, which tightens your blood vessels, raising both your blood pressure and your heart rate. And over time, this damage builds up, weakening your cardiac muscle and leading to heart failure, which is why it's so important that we go after these risk factors so we can save as many lives as possible. And now that we have gone over the risk factors, let's take a look at how AI helps diagnose patients with heart failure. 2 of the new ways we see AI is a piece of eye software technology and the AI CDSS. This eye software technology catches permanent damage markers in your eye caused by ischemia. And since ischemia is such a critical cause of heart failure, catching it earlier on can help prevent further damage and treat heart failure patients earlier than previously possible. The second one, the AI CDSS, or more commonly known as the Artificial Intelligence Clinical Decision Support System, is able to diagnose patients with heart failure more effectively. It combines specialized knowledge and pattern recognition technology to produce more accurate results. As you can see from the chart, regardless of if it's heart failure with reduced, mid-range, preserved ejection fraction, or not even heart failure at all, it's most accurate in its hybrid format, being both expert-driven and machine learning driven. Aside from its accuracy, another benefit is that it can serve as a primary diagnosis of heart failure when a specialist is not available, because it has a accordance rate of 98% with specialists and 76% with non-specialists, meaning that this system is more accurate at diagnosing patients with heart failure than a non-specialist would be. But now that we are able to diagnose patients with heart failure, a treatment plan must be developed, which is why I'd like to hand it off to my colleague Shanze to further discuss.
Thank you, Arul. There are 4 different classes of heart failure recognized by the New York Heart Association. Class 1, there is no limitation of physical activity. Physical activity does not cause any symptoms. Class 2, they're comfortable at rest, however, physical activity causes some symptoms. Class 3, they're comfortable at rest, however, ordinary activity causes symptoms like fatigue, palpitations, or dyspnea. Class 4, they're unable to do any physical activity without discomfort. Symptoms of heart failure show even at rest. After diagnosis, determining the class of heart failure is essential in providing the appropriate treatment. Heart failure is a chronic disease, so it is not curable. However, treatment is provided to patients to improve quality of life, reduce the symptoms, and strengthen the heart. The main treatment options for HF are lifestyle changes, medications, implanted devices to control rhythm, and surgery. Class 1 of treatment should be geared toward lifestyle changes. Patients should quit smoking and drinking alcohol. They should start exercising and lower their sodium intake by having a healthier diet. By Class 2, all patients should be on medication. The most common and most effective medications are diuretics, beta blockers, ACE inhibitors, and angiotensin II receptor blockers, also known as ARBs. Diuretics like aldactone treat edema and hypervolemia by getting rid of the excess water and salt. With the fluid gone, the blood pressure decreases and the heart is able to pump blood with less effort. Beta blockers block epinephrine to lower the heart rate, reduce the heart's pressure, and improve blood flow. ACE inhibitors and ARBs help widen the blood vessels, improving blood flow by blocking a chemical called angiotensin II, which constricts the blood vessels. In Class 3 of heart failure, implanted devices like ICDs and CRTs are a possible treatment option because patients with heart failure have a higher risk of arrhythmias. Cardiac resynchronization therapy, or CRT, is a type of pacemaker used for heart failure. It uses leads to send electrical pulses to the left and right ventricles to help them beat more synchronously. ICDs, or implantable cardioverter defibrillators, are essential in preventing harmful arrhythmias like VF and VT. It uses electrical shocks to get the heart out of abnormal arrhythmias that can further weaken the heart. The last treatment option is surgery. 2 types of heart failure surgery are valve surgery and coronary artery bypass graft surgery, both of which help the blood to flow in the correct direction. Another treatment option is a left ventricular assist device, which is essentially an implanted mechanical pump that helps the blood flow to the rest of the body. Doctors recommend heart transplant as the last possible treatment option after all other treatment options have been tried or considered. Now I'd like to pass it off to my colleague Ronak to talk about treatment with revolutionary technology.
Thank you, Shanze. So new technology is constantly emerging in hopes to find more effective treatment for heart failure. Allow me to introduce you all to the future. First, we have stem cell therapy, which utilizes pluripotent stem cells in order to restore functionality to a damaged, scarred myocardium as a result of a heart attack. So researchers have done is that they've taken these stem cells and they've treated them with specific growth factors to transform them into beating cardiac cells, which they then transplant into the scarred myocardium. Those cells then synchronize with the host heart. Amazingly, researchers have found that this therapy can increase ejection fraction by 22% in monkeys with heart failure. Next is my personal favorite, the robotic heart sleeve, which utilizes a silicone-based air pressurized system to wrap around the outside of the heart and contract laterally and helically, mimicking the function of the heart. This device has found to increase cardiac output by 118% in pigs with heart failure. And this fixes 2 key issues for end-stage patients. The first being low donor availability for transplant, and the second being the fact that this device has a lower risk of thromboembolic events compared to left ventricular assist devices. Now, these are the treatments of the future, but we're in the present where prevention is key. Because heart failure is so deadly in our society, I believe that every physician across the nation needs to provide this information to their patients, either in the form of our brochure or in the form of telehealth visits in concordance with yearly echocardiograms. By informing people of why heart failure is so deadly, we can help reduce high-risk behaviors such as high-sodium diets and drug and alcohol abuse. Currently, there's a 23% readmission rate for heart failure patients across the nation, costing healthcare $30.7 billion a year. And there's an easy fix to this: education. By educating the community on the comorbidities that are related towards higher rates of readmission, we can have heart failure patients attack those conditions and overall reduce the high readmission rate. On top of that, demographics also play a key role, as African Americans, male, and Medicaid patients, just to name a few, all have higher risks for readmission. If you take a look in our brochure, you'll find a chart and a corresponding table that allows a heart failure patient to self-assess their risk for readmission, allowing them to 1, advocate for more aggressive treatment, 2, allowing them to comply with their aggressive treatment, and 3, allowing them to understand that their risk for readmission is related directly to inherently who they are. By educating the community, we can overall reduce the rates of heart failure, reduce rates of readmission, and most importantly,
Mend a broken heart.
Thank you.